How do you source out for drugs?
Every person with sickle cell disease is actually on his own in this country. There's no free medication or whatsoever in this country for people with sickle cell disease. Not even subsidy. Eating balanced diet
It's necessary.
helps. It's necessary. It's not even optional.
Wow.
It's not even optional. It's mandatory for every person that has sickle cell disease. If not, you are going to be anemic. And once you are
Welcome. This is The Conversation, where we dive into the most pressing issues of our time. My name is Beatrice Okimbale. Sickle cell anemia is one of the most serious diseases affecting millions of people, especially in tropical Africa. Sickle cell anemia is a genetic disorder that affects productions in red blood cells. Health experts say it is crucial to diagnose the condition early to manage its symptoms and prevent complications. There's also a vigorous campaign to even prevent it from occurring. This is by ensuring that a man and woman who belongs to the same AS blood group are prevented from getting married or producing children, as they are almost likely to bring forth children who are carriers of the sickle cell virus. Medical experts say if a person is experiencing symptoms like anemia, pain episode, or infection, such a person should consult a healthcare professional. In Nigeria, statistics shows that a staggering 4 to 6 million people live with sickle cell diseases, with approximately 100,000 to 150,000 newborns affected annually. This represents about 33% of the global burden of the sickler. Our conversation today, we will talk about the challenges of sickle cell disorder in Nigeria. Our focus is on the sickle cell anemia, the warriors of sickle cell, their battles, and their hopes. I have with me here the Executive Director of SAFA Sickle Cell Aid Initiative, a non-governmental organization led by people with sickle cell diseases to champion policies reforms, sustainable livelihood for sickle cell warriors, Mr. Farouk. And I have with me here Mr. Salih Farouk. It's good to have you here, sir.
Thank you very much, Beatrice.
All right.
Glad to be here.
Yes. What do you think about sickle cells? Who are even the sickle cells warrior?
Well, the sickle cell warriors are people who are born with a genetic condition, people who are born with the sickle blood, and it's when actually couple get married and their genotype is not compatible. And when I mean by not compatible, it's like when, for example, you are ES and then your spouse is ES and you get married, so there's a high probability that you will get a child with sickle cell disease. That's the genotype SS gene genotype. So that's the sickle cell trait. So you are carrying a trait of a sickle cell, and then your spouse is also carrying a trait of sickle cell. That's the S genotype. And so that means that's when you actually get a child with sickle cell disease. That's the SS genotype. So it's a genetic condition.
Okay, so just like you said, we all know what causes other diseases. We know what causes diabetes, we know what causes HIV. But what really causes sickle cell disorder? What causes it? Apart from, SS, genotype, just like you explained, but no, what other causes that is a sickle cell disorder?
Well, when you said other causes, do you mean the crisis or you mean
we'll come back to the crisis. I mean the disease itself, well, the sickle cell disorder. So it's only if you are SS that was signify you as a sickle cell, right? So definitely you have sickle cell disorder.
Yes.
So what are those sickle cell disorder?
Well, like I told you, the disorder, it's when your trait and your spouse's trait, it's comes together, and then you get the SS genotype. And then the disorder itself is the blood being sickled. You know, the normal blood of a man, it's cycled in shape. Okay. Yeah, but then the blood of a person with sickle cell disorder, it's sickled. So that's the disorder. The disorder is the blood not being normal in shape, but being sickled instead of cycled. So that's the disorder. So when the blood is sickled, that's when you get sickle cell disease.
Okay.
And then you know, the normal flow of a blood, the vessels,
Yes.
the vessels of a person with sickle cell disorder, it's just like your normal vessel, but then the shape of the blood, that's what is different. So the flow of the blood tends to be different. Your own blood will flow quite very well, you know, but then because of the sickled shape of a person with sickle cell disease, his blood will not flow the way
Very
it's
well,
supposed
right?
to flow. Yeah, the way it's supposed.
Okay.
So that's the disease. That's the sickle cell disease.
Okay, so those are those things that brings disorder. So just like what you explained now, I say someone with AS does not have a full grown LD blood, because you know when AS and AS means, which means two contaminated blood mixed together to give birth to a child that now cause SS. So the S in their hair has a disorder, right? So which means AS2, they are not 100% LD.
Yeah, they carry the trait.
The traits
of the sickle
so
cell.
which
Yes.
Okay. That's what I'm trying to
But
understand.
it's not that
So
they are not healthy. It's not
Okay.
that they are not healthy or their blood is contaminated. No, it's just that they carry that trait of the S gene. You understand?
Mhm.
Yeah. So because of the trait they carry, that's when they pass it now to their offspring.
Mhm.
Yeah. So the offspring is the one who has the problem, not the parents actually. That is why most specialists advise against you know, an SS someone with AS genotype marrying someone with AS genotype, or having a child with someone with AS genotype, so that we avoid prevalence of having children with sickle cell disease.
Okay. So what are the crises that happens to SS patients?
Well, the crisis, it actually happens when the blood clots. Like I told you earlier, the vessels are normal vessels, but then the blood is sickle, so they don't flow very well. So what happens when a person with sickle cell disorder or sickle cell disease gets crisis is when the blood clots. For example, like my blood can clot here, you know, due to the because the vessels are not wide enough to
pass freely.
For the blood to pass freely, you understand?
Okay.
So when it gets stuck, when the blood gets stuck, when the vessel block and then the blood gets stuck, that's when the crisis starts, and that's when you will start having joint pains, sometimes amnesia, sometimes fever also, and swelling of the body.
Okay, and you know that they are always constantly on LD. So is it that most often their blood clots always happens, like in a week they might have crisis 3 times?
No,
we've experienced something like that.
No,
we've seen something like that.
They are not constantly unhealthy. Like I'm here now, I'm chatting with you now. I have sickle cell disease also, but I'm here now, and the last time I had crisis, I think it was about 5 months ago. So they're not constantly unhealthy. It depends on how you take care of yourself. You understand your medication. There are some certain rules about for people with sickle cell disease, and these rules are, you know, you have to make sure you take adequate water. I'm sure you can see that my eyes are yellow.
Oh.
Have you noticed that I'm having a colored eye? Yellow eyes. Right, yeah, now. You just did. Right. So it's because for the past 72 hours, I haven't been taking adequate water. And this yellowish eye, it's actually kind of a warning. You understand that, okay, my system needs water. If not, my blood will clot, you understand? Okay. So most people with sickle cell disease actually have this yellowish eye, and that's when they tend to neglect fluid intake. Not necessarily water, anything fluid. When you take it, it will help. And what it does is it helps the blood. It flushes the blood, you understand? So with adequate water, the vessels
moves.
Move, exactly.
Okay.
Yeah, they move the blood quickly and freely. So it's not actually, they're not always unhealthy. It's just that I think what you mean is that their nature, they tend to be fragile, you understand?
Yes.
And that's because that's blood that is not normal, flowing well, exactly.
Okay.
But they are not always on a hospital admissions, and they are not always sick. Like you can see now, I'm healthy. Me, I didn't tell you. You wouldn't know that I'm a person with sickle cell disease also.
Yeah, but I understand that you are doing actively well, but there are some people that they are always in and out of hospital. We've seen so many cases like that, and just like the way you described to us that, okay, if you are not taking care of your health, means you have to have close monitoring and understand your body, to be able to know, okay, this is the time to take water, just like say, time to follow your medication. But we know, we also know this, that in Nigeria, the statistics of the burden of sickle cell in Nigeria is like 4 to 6 million, staggering. Because we made and that's about 33% of the global burden. So why is the situation that bad in Nigeria?
Honestly, the statistics is even not accurate. It's a lot more than that. It's more than that. There's no official data for people with sickle cell disease, and there's no accurate data anywhere for people with sickle cell disease in Nigeria. Like, we've challenged NBS that we need data for people with sickle cell disease. We need to know how many people have sickle cell disease in Nigeria. What are the age range? How many females have sickle cell disease in Nigeria? How many males and how many children are being born with sickle cell disease every day in Nigeria? They don't have that data. Someone just
quite bad in Nigeria.
I've been saying it. Someone just sat in his office and said that six. It's a lot more than that. Nigeria has the highest burden of people with sickle cell disease in the world.
Wow.
And you know that Nigeria has the highest population in Africa.
Yes.
Yeah. So that data, it's inaccurate. At Sulfur Sickle Aid Initiative now, we've taken the board and that we want to create a database, national database for people with sickle cell disease. And we want to carry out data collection. We want to go out on the fields. We want to test people. We want to know how many people have sickle cell disease in a specific local government, in a specific ward. How many people have that sickle cell disease? We need their data, because without that data, you can't even actually get policies. And you said sickle cell disease, it's in stages. Yeah, there are people who have anemia, and there are people who don't. So most people that you see that are always in and out of hospital actually have anemia, and that depends on the nutrition. Nutrition helps curtail anemia.
Okay.
Yeah, even you, like, I don't know your genotype, but probably you are AA. But if you're not eating well, you're not having your balanced diet, you might also have anemia. You understand? But for people with sickle cell disease, it
tends to get faster to them.
Exactly. That's because of the nature of the blood. Yeah. You understand? And the fragility of their body system. Exactly. And why do we have most people with anemia in Nigeria? It is because there's no help anywhere for people with sickle cell disease in Nigeria. Like, I'm boldly saying this. And anyone who thinks they have any help for people, or any maybe intervention or support for people, any state that has intervention or support for people with sickle cell disease, should come forward and challenge me. There's no support for people with sickle cell disease, and these are the people who battle a lot with medical bills. You understand? Like an admission can cost more than 100,000. And you know the inflation now in Nigeria, and you know the poverty rate in Nigeria.
Yeah. Exactly.
So, and most especially in the north now, you know, they tend to have so many children. You know, in a family you can get like 17 children, 10 children. You understand? And then you have one child with sickle cell disease. When you are battling to feed your 20 or 17 children, how will you cater for the one who needs help? serious attention and help, you understand? So that is why you see most people with sickle cell disease going in and out of hospital, and that's because they are mostly anemic. Honestly, that's the issue. But some of them just go for normal routine checkups, you understand? Sickle cell, people with sickle cell disease go for checkup so that they will check their PCV, that's their blood rate, you understand, so that the hematologist can know if the blood is increasing or it's decreasing.
Okay, okay. So in according to what you said about your organization trying to get a database, so also your organization, does it prevent or preach against two people marrying together, you know, AS and AS patient? Do you people to also preach against, you know, to avoid situations like this?
Technology has made everything easy now with IVF, in vitro fertilization. An AS can actually marry an AS, and then if they decide to go, they can decide to get married and go for IVF, in vitro fertilization. And during that in vitro fertilization, they can do genotype selection. You understand? During the lab mix, what they do in the lab, they can choose the genotype of your child for you. So,
but you know, that's a long process, and that's one of the option. Painful. Is a side option. Yeah. The best one is don't even go there. So does the organization
if you can't afford IVF, if you can't afford IVF, don't go for it. But if you can't afford IVF, I don't see any reason why you shouldn't go for it.
So your organization is in the middle. If you can afford IVF, no problem, you can marry. But if you can't avoid, so you people are not preaching again. Don't even go there. So like AS, you know, so that it will reduce the statistics. And you said help is not coming short.
No,
and it will give it, and it's also even reduce the burden of your organization. You know, trying to get help from people and trying to start advocating for SS patients. You know, trying to get their medications and other stuff. You know, trying to reduce the cost of death.
No, there's something I want people to understand, most especially Nigerians.
Okay.
Sickle cell disease is not a curse. It's not a death sentence.
Yes, we know. But it's like a painful illness that goes through. The person that even have it.
If managed well,
okay.
If managed well, sickle cell disease is something that can be lived with. You understand? If managed well. So it depends on the parents. It depends on how devoted they are willing to be to their child. You might decide to have only one child, and that child comes with sickle cell disease. I'm sure you will devote all your life to that child, and then you will give the child whatever he needs to stay healthy. You understand? Whatever it is required for the child to stay healthy. And even the crisis, like I told you, it can actually be managed. It can be prevented. Once you teach your child to take adequate fluid, you know, avoid things that might cause crisis, stress, rigorous exercise, you understand, and eating healthy meals, balanced diet, your son won't be anemic if all those things will be looked into, and you will be devoted to preventing the crisis. Your son will be healthy, or your child will be he will be healthy. You might hardly even face crisis, honestly. You understand? So that is why we are advocating. I don't believe people should. I don't believe in a methodology that people should be prevented from getting married because we are trying to avoid a certain genetic disease. It is a genetic disease, and I don't think that someone for example, a child should not get to be in this world because of the scare that he might come with sickle cell disease. You understand? The government and organizations like Sulfur Sickle Aid Initiative like mine should come together, find a formidable solution that we can that this disease can be managed. You understand? We are not there yet to say that we will have zero chances of people giving birth to people with sickle cell disease. Nigeria is not there yet.
Exactly. So the best option is we should just don't even try it.
No,
I think it's an,
that is what I'm saying.
advanced country. We get that, okay, just like the options of IVF. Is that even the only options available for sickle cells anemia?
No, not people with sickle cell. You said
no,
the
to
AS
prevent,
trait. Yeah,
yes.
the people with AS trait. Yeah, so far IVF is the only option.
You see, so they don't even have numerous options, and it's just only one option. I understand what your organization is trying to do. Yeah, you don't want to prevent law from happening, but at the same time, we need to face reality. You get, so bringing a child to the family and causing the child serious pain consistently is not something that is quite good.
It depends on the seriousness of the government and the devotion of the parents.
Yeah, and you said you also said it. We are not there yet.
If the government,
let's just be managing it till we get
what
there.
I said is we are not there yet to prevent marriage that will lead to having offspring with sickle cell disease. The awareness is not there.
Okay.
The government is not doing anything about the awareness creation. There's no specific budget for people with sickle cell disease today in Nigeria. So how will you extend the awareness to people in the rural village, in the rural areas?
Okay.
You see?
Talking about that awareness, let me check. Where is the place of public awareness, in Nigeria about sickle cell disorder?
That's exactly what I'm saying. The government is not ready to do that. Or let me say, they are not ready yet to do that. But organizations like mine, like the Sickle Cell Nigeria Foundation, they are based in Lagos. They are doing quite very well in creating awareness about sickle cell disease. You understand that? But now what we are trying to do is even to shift from that awareness creation, because I have been telling executive directors of sickle cell organizations, people like me, that look, we have sickle cell disease. We are carrying the disease. It is not our responsibility to prevent people from having children with sickle cell disease. Rather, our responsibility is to ensure that the government has adequate policies that will protect the rights and well-being of people with sickle cell disease. We want to shift from that awareness about preventing marriages for sickle cell disease. That shouldn't be our responsibility, us that already have the disease. Our responsibility should be the well-being of our fellows who have this disease. You understand?
Okay.
Subsidized health care. You understand? Policies like subsidized health care. Policies like employment opportunity. Policies against stigmatization and discrimination. That is what we that have the disease should be advocating for. And let's leave the awareness about preventing having children with sickle cell disease to the government. That's their responsibility, because the burden should be on them, not on us. And that is why earlier I said it's not a cause. Just because I have sickle cell disease, that does not mean it is my responsibility or it is mandatory for me to preach to people not to get married so that they will not have children with sickle cell disease. No.
Okay. So
I think as an advocate, my responsibility should be ensuring that people who have the disease like me get to have a very sound healthcare system. You understand? They get employment opportunity. They get included in policies and programs of the government and organized private sectors.
Okay. So do sickle cells or these other warriors, do they suffer discrimination and stigmatization? Because I know immediately you tell someone you are SS, they'll first give you that pity face, that kind of thing.
Exactly.
So that's the first thing. That's the humanity in them. So first give you that kind of pity face. Then secondly, then they will not give you that discrimination face. Yeah. I don't want to be in trouble. No, now to the aspect of marriage, don't even go there. That's the way you get my point. I cannot start nursing a constant sickler. I'm talking from the perspective of general audience, general people. That's how they think about sickle cell. Because that's why I asked you the other time that we know those sickle cell patients, they're always in and out of the hospital. So we see them as a constant disease, a constant sickler, just like cancer. We relate them together with diseases that are very, very serious. You get. So now I'm not asking you, do they suffer discrimination and stigmatization? How do they cope with that?
We do suffer discrimination. I won't say they because I'm part of it also. So we do suffer discrimination and stigmatization. And I think the highest is when it comes to marriage, you understand. Someone with an AA genotype, that's someone who is not carrying the gene at all, the S gene at all. I think they tend to be more discriminatory against people with sickle cell disease, you understand. Yeah, and because people with sickle cell disease are only allowed to marry people with the AA genotype, you understand. And when that happens, you see like people with the AA genotype, they tend to take themselves high, like you need me, you understand, that kind of a thing, you need me. So they'll be like and then sometimes they will be running away from the responsibility, like you said, in and out of hospital. They will
and
think
they might
like
even put their love on conditions.
Yeah, they will think like when I marry this lady or when I marry this guy, I think we'll always spend our days in the hospital. They won't be fun, you understand. And it's actually not like that, you understand. People with sickle cell disease, I think they are the strongest people I've ever seen in this world. Because someone with crisis, someone having a serious leg pain, you will see the person going up and down trying to make a living. You understand? Trying to have a sustainable livelihood. You understand? So, but then the discrimination, it affects the emotional well-being of people with sickle cell. Psychologically, it affects people psychologically. And that is why at Alpha Sickle Aid Initiative, we also have this psychological counseling segment where we counsel people with sickle cell disease, most especially people who face discrimination from their spouses, you understand, or people who face discrimination when it comes to marriage. Because sometimes when it's actually coming very close, that you see that the spouse or the partner will just take off. You understand? So we have so many issues like that. Wow. And then when that happens,
a lot of
people fall into depression, you understand.
We'll recover to more about what's your organization. But let's go on a short break. When we'll be back, we are talking about sickle cell disorder. Welcome back. If it's just joining us, this is the conversation, and we are speaking about sickle cell disorder and how to manage it and what are those things that comes with it. And I have my amazing guest, Mr. Farouk, who has to tell us a lot, a sickle cell survivor, and also runs an organization that advocates for sickle cell disorder. So let's continue, sir. Let's pick it up from that discrimination from that side. What is your organization? What they do about those matters? Those discrimination and stigmatization. How does your organization comes in? They helping?
Well, we can only mitigate for now, because there are no laws that prevents or that are against discrimination of people with sickle cell disease for now in Nigeria.
How do you even motivate them?
Motivate?
Because you say it affects their psychological thinking sometimes.
Yeah, we have counseling segments, like I told you at Alpha. We have counseling segment, and we have psychologists, professional psychologists, who carry them through the counseling process, and mostly actually the outcome tends to be very positive, you understand. Wow. And then we do matchmaking also for people who go through that situation. So we do matchmaking. There are people who actually want people with sickle cell disease, but the people who discriminate are on a higher risk. So we do matchmaking at Alpha Sickle Aid Initiative also. We connect people with people that have a genotype, you understand, and then if you like each other and you love each other, you get married.
So what are the advantages of being a sickle cell disorder? Just like the way how proud AA patients can be, you get my point. So if apart from because we tend to just know about the disadvantages, you get what happens as an next stage. So what other strengths I'm sure the genotype cannot just not have the strength area, you get. But we always just look about their weaknesses. That's why we see SS as a no-go area. So what are their strengths? Because all genotype always have weaknesses and strengths. So what are the strengths as an SS? Maybe it can even motivate the audience and say, we're trying to enlighten our viewers here and tell them about, sickle cell is not that bad of a case that you could consider if you meet an SS patient.
Well,
there's no strength at all as an SS.
Of course, there is.
So
there is, but it depends. It depends on the person carrying the disorder. Actually, you understand. But when it comes to the disease, does any disease have any advantage? I don't think so. I don't think there is any disease that has advantage.
As a genotype, now I'm just saying that I know SS is a bad genotype.
We won't say bad, but
I won't say bad. But we know all genotypes have their strengths and their weaknesses. SS does not have any strengths.
No. It's not that it does not have any strength.
Okay.
I told you, the people with sickle cell disease are the strongest people I've ever seen. You understand? Mm-hmm. I have never seen a person with sickle cell disease who is lazy. Honestly. I've been in and out of this country. I've been to so many places, so many states and villages. And once we identify a person with sickle cell disease, you see that the person tends to excel more in that community. You see? But when you are talking about the health condition, I actually can't see, Beatrice, because I don't think there is any disease that you say it has any advantage. You say there is any disease that has advantage. I don't think there is in this world. Yeah, everybody is trying to avoid one disease or the other.
Yeah, that's true.
So I don't think so. It's normal, even for people with sickle cell disease. It's normal. So there is strength. There is strength in the mindset.
Okay.
You understand? There is strength in the devotion, and then the love also. There is strength in that because people with sickle cell disease are caring. You understand? They are loving, but when it comes to the health condition, like I was saying earlier, I actually can't see.
Okay.
I can't see, honestly.
Now we understand where you're coming from. So sickle cell disorder warriors, how do they source for drugs? Because we know even other lesser diseases, we hardly even see the medications and the drugs here in Nigeria. We know how the health condition of Nigeria be. So for people like you guys, how do you people source for drugs? How do you ascertain to get enough medications to treat yourself? Because you people have to always be attentive to your health. So how do you source for drugs? Or is there a free? Because we know HIV patient people, then there's free drug services for them. We will know how expensive their drugs can be. And the international organization came in and there's free drug services for them in Nigeria. So did you people enjoy stuff like that? So how do you source out for drugs?
Every person with sickle cell disease is actually on his own in this country. There's no free medication or whatsoever in this country for people with sickle cell disease. Not even subsidy.
Wait, not even programs for assistance from the government or organizations or NGOs that
have
stuff
NGOs like I said, like Sickle Cell Foundation Nigeria. You understand? NGOs like them, NGOs like Self Sickle Aid Initiative, they give intervention for people with sickle cell disease, and we do outreach also to give out free drugs for people with sickle cell disease. And the most common drug for people with sickle cell disease is folic acid and paludrin. Unless when you are on hospital admission or you are having crisis, and that's when you start having painkillers, analgesics, you understand, or drugs. Injections that will reduce the rate of the pain for you for some certain number of time for some time, but the most common medication, it's actually folic acid and paludrin. And when you're on admission, you get put on fluid, that's the normal saline, you understand. So that's actually the most common treatment for people with sickle cell disease today in Nigeria.
Are the drugs everywhere?
Yeah, folic acid, it's
And how
Paladrin,
expensive
they
can it be?
are actually everywhere. Well, because of the inflation now, and everything's expensive now because of the fall in the naira. I think folic acid, it's about 2,000 naira now per card, and then Paladrin it's about 3,000 to 4,000 naira per card now, depending on the location.
So how many you have to use in a week or in a month?
It's daily.
It's daily that you
Yeah.
have to take it.
You have to be
So
taking
which
it
means you have to frequently be buying the drugs.
Exactly.
Wow.
Exactly. And then that card will only last you a week. Yeah.
Wow. And the affordability is small.
Yeah, the affordability is small. And that is why we are calling for government intervention. People with disability, they now have their agency. They have a National Commission for Persons with Disabilities, and they have their anti-discrimination law. They have their protection rights. There's employment opportunity for people with disability, 5% quota of employment. Anywhere that are carrying employment, they will have to employ 5%. They have to give 5% from that quota to people with disability. You understand? And like you said, people with HIV and AIDS also, they have their center for HIV and AIDS control, right?
Yes.
Yeah, but what about people with sickle cell disease?
So there's
like
no government organization that deals with sickle cells patients.
Just the Federal Ministry of Health, and even at the Federal Ministry of Health, there's nothing serious about sickle cell disease going on there, right there. Like, we've submitted countless letters trying to even hold an engagement with the Federal Ministry of Health so that we can actually get our license to start that national data collection for people with sickle cell disease. And the response is quite negative. It's negative. This is what we want to do by ourselves. Like, we want to do it. We are not asking the government to do it. We are not asking them to go out and do it. We want to go out to get that data, because without that data, you cannot make good policy
you can
reforms.
reach out to people
you don't even know how many people you are actually trying to reach out to.
Yeah.
So you need that data to make policy reforms. So that's why we say, okay, the first thing we need is the data for people with sickle cell disease in Nigeria.
Okay, so what are the policies and the reforms that your organization does or deal with?
The first and the most important policy now that needs to be done in Nigeria is subsidized healthcare for people with sickle cell disease. Because people are suffering in Nigeria, not just people with sickle cell disease. Everyone is suffering now in Nigeria.
Yes.
Yeah, and when you are battling to afford at least 2 square meal, you are battling to afford a 2 square meal. How will you then budget almost about, like I just told you, the prices of the drugs? How will you budget about 10,000 naira weekly to purchase drugs so that you will not fall into crisis? And when you get that crisis, when you fall into crisis, you will spend nothing like 100,000 naira.
Wow.
And then the income is so very low. It's low. And that is why we tend to have high rate of mortality for people with sickle cell disease today in Nigeria. The mortality is increasing, it's not decreasing. And why is it increasing? Because of the poverty rate. People cannot afford a healthy square meal. Like now, at Safa Sickle Aid Initiative, we have this SafeNet program. And this SafeNet program, we are targeting people, that the most vulnerable people with sickle cell disease, people who live less than $1 a day, people who cannot, that they can't have 1,500 naira a day. Having 1,500 naira a day, it's difficult for them. So these are the people who cannot afford a 1 square meal. And earlier, when we started this program, I told you that eating balanced diet
is necessary.
It's necessary. It's not even optional.
Wow.
It's not even optional. It's mandatory for every person that has sickle cell disease. If not, you are going to be anemic. And once you are anemic, you know the result.
Yes.
That's when you get admitted, and mostly people don't make it out. So that is why we are targeting the most vulnerable, because they need the most attention now. The most vulnerable people with sickle cell disease, they need the most attention now because of how the economy is in Nigeria now. So we target them, and then we give them some kind of monthly stipends. You understand, monthly stipend, so that they can actually live above that poverty line. We are trying to reduce the poverty line for people with sickle cell disease. So when talking about policies, Nigeria needs to make policy. There should be a policy that will subsidize drugs for people with sickle cell disease, or even have the drugs free, or subsidize hospital admissions for people with sickle cell disease. You don't need to be working for you to have insurance. Once you have that sickle cell disease, there should be a policy that your drugs will be subsidized. We engaged national hospitals sometimes ago. I think it was 2 months or 3 months ago. I think it's 3 months ago, and we engaged them, partnered with them to have subsidized drugs for people with sickle cell disease. We are going to contribute to it. The South Sickle Aid Initiative will contribute to it. And then we made some criticisms about the emergency room. And fortunately, the CMD was so welcoming that actually 2 months after our visit, things changed in National Hospital Abuja. There's National Hospital Abuja.
Wow, that's amazing.
Yeah, because initially, when a person with sickle cell disease visits the hospital, there's this nonchalant attitude from the emergency staff, the emergency room staff.
Management.
Yeah, the emergency room staff actually.
Wow.
Yeah. The first thing that a person with sickle cell disease needs once he is in crisis and goes to the hospital is for you to give him a painkiller to subsidize the pain. I told you it's joint pains. Yes. You understand? Yeah. And once you start having that joint pains, if not managed well, you can easily fall into coma or faint or other things. You understand? Yeah. So it gets high if not managed well. So we talked to National Hospital about those problems that our people are facing at the hospital, and to our surprise, they actually put that into effect. So now, once a person with sickle cell disease goes to the hospital and he's identified himself as a person with sickle cell disease, they tend to attend to him faster. And National Hospital also installed this Mediboard. You understand? Yes. That will allow the management to track what the emergency room staff personnel are doing. So once a person has not been attended to, once it's about 15 minutes and the person has not been attended to, it will set an alarm. Understand?
Wow, kudos to the National Hospital.
Yeah, kudos to the National Hospital. Actually, we commend their efforts. So these are the type of things we need. If the Federal Ministry of Health and the state ministries of health will actually make such efforts that National Hospital has done, things will be a lot better. Yeah,
so if they can put it in both federal and state hospital, ensures that both government hospitals are following that kind of rules. Those protocols, rather, things can be much more easier for sickle cell patients.
Right? Exactly. But not just that. Like I said, we need subsidized drugs also. Subsidized hospital admission bills. You understand? Like Beatrice, I told you, the last time I had crisis was about 5 months ago. 5 months ago, roughly, yeah. And then I think what I spent roughly when I was admitted was about 1.5 million. Wow. And I was admitted for just 4 days. But I spent about 1.5 million. Because I had crisis, I lost 1.5 million just because I had crisis.
And does it lead to anemia, or
no?
Just the normal,
just
not even the
crisis.
anemia.
Yeah, not even the anemia.
So
I'm not anemic.
Anemia patient.
So now let anemia patients, exactly. Think about anemia patients now, but not even anemia patients.
Yeah,
you can have anemia patients who are doing well. Now think about sickle cell warriors who are living below the poverty line. And they get admitted. People who cannot afford 1,500 naira a day. Their parents can't afford 1,500 naira a day. How do you expect them to provide such amount of money to cater for their health?
1.5 million just for 4 days admission for sickle cells. Yes. Help. So what do you want us to? Yeah. They said bone marrow helps with sickle cells. You understand? So what do you think? Like bone marrow operation? No, it's said to be one of the life-saving options for sickle cells. So is it really a life-saving option? That's one. Then how accessible is this medical options in Nigeria?
Bone marrow transplant, it will not, bone marrow transplant does not change the SS genotype, but it reduces the burden of the disease very, very well. Like you tend to have low sickle cell crisis when you have bone marrow transplant. But bone marrow transplant is quite expensive.
Yes, we know.
It's quite expensive.
And is it accessible in Nigeria?
Yeah, it's the accessibility of bone marrow transplant in Nigeria. It's very low. Not because there are no hospitals who do bone marrow transplant in Nigeria, but the amount, it's what people cannot afford.
Oh.
You don't expect, like we are 6 in my family now, you don't expect my parents to just remove 10 million naira just for me to have bone marrow transplant. And even bone marrow, it's not 100% certain that I will not have I will not have crisis. No, I will not have consistent crisis. I think that has been established. I will not be having consistent crisis. But it's not certain that I will not have crisis at all.
Wow. So which means...
And it does not change my genotype. So just because I pay 10 million naira to have bone marrow transplant, that does not mean I can go and marry AS person.
Yeah, we know it does not change your genotype, but it makes you live more healthier.
Yeah, it makes people more healthy. Yeah, it's an option. It's an option. But like I told you earlier, like even without bone marrow transplant, I'm not advising against bone marrow transplant. If you have the money and you want to go for it, fine. You can actually go for it. It helps. You understand? But sickle cell disease, if managed well, you can
also get the result that bone marrow will give you.
Exactly. Exactly. Like I told you, like I don't have frequent crisis, and most people who manage their health very well, people with sickle cell disease who manage it very well, they don't have frequent crisis. You understand? So what they need actually for us to reduce the mortality rate, is interventions for people with the disease. You know, laws that will protect the rights and well-being for people with the disease, like the employment quota. You understand? Empowerment helps a lot. If the government will actually invest in that, empowerment helps a lot for people with sickle cell disease, because once they have something doing, like I told you earlier, like they are strong, and they are people who does not like being dependent. You understand? So once people like that have some kind of an empowerment opportunity, they will excel and they will cater for themselves very, very well. They will manage their health very, very well. They will buy their drugs. They will have their balanced diet. They will be able to afford their 3 square meal. And everything will be okay. While we are actually looking for all this bone marrow, trying to prevent the having a child with sickle cell disease, it's because of the lack of policies. You understand? Beatrice, trust me today, if there are policy like today, if you have a child with sickle cell disease, once you give birth to that child with sickle cell disease, he is going to have a trust fund account from the government. A trust fund account that will cater for his health, that will be paying for his medical bills, that will be paying for his drugs, that will subsidize his education. You understand? Trust fund account that will make him included in other opportunities or there are actually scholarships availability for people with sickle cell. There are specific scholarship opportunities for people with sickle cell disease. Trust me, you will not be running from having a child with sickle cell disease, Beatrice. You won't. Because like everything will be okay. You understand? If there are good hospitals for people with sickle cell disease, standard blood banks, only meant for people with sickle cell disease. You know that the care is there. If you know that you are certain that the care is there, you won't be having panic attack if you if you are going to have a child with sickle cell disease, or if you have a child with sickle cell disease.
Okay. So what's not the level of researchers, statistics, scientists? Have they really gone far, finding a more cure or even locally made traditional drugs, that can cure stuff like that? Is there really any updates and stuff like that?
Let me go for the traditional drugs, like you said, before I now go back to the scientific research. We strongly advise against going for traditional drugs.
Okay.
There are these herbalists who say that if you take their drugs, like your genotype will change or whatsoever. It's all a lie. There's no scientific proven medication or whatsoever that will change genotype from SS. They even say to AA. Not even AS.
Wow.
So it's a lie. And any herbalist who thinks he can challenge me, he should come and prove it. I'm available. They should come and prove it. They should challenge me. It's a lie.
Okay, so what are the researchers?
We advise against traditional Medicaid drugs.
All right.
We actually have a case now. There's this priest that we are taking up legal action against, and he abused a person with sickle cell disease.
Wow.
Yeah. He told the person that he's constantly slept with the person. You understand? Constantly, repeatedly raped the person with the idea that her genotype will change from SS to AA.
Wow.
So had it been there are laws that are against that now? Had it been there are laws that are against that now? That person will be looking at nothing less than 15 years imprisonment.
Yes, yeah.
But even without the laws, and that is why we are advocating for the laws, and that is why we are advocating for the policies, so that such things can be prevented. So we are going to take a legal action. We are going to take a legal action with that priest now. Our legal team are already working on it. We are going to take a legal action. And then talking about the scientific, Bill Gates Foundation. They're actually working on a permanent cure for sickle disease, for people with sickle cell disease now. I don't know how it's going to be. I don't know if the genotype it's going to change, or is the crisis. You understand? Or the sickle shape of the blood will change. I don't know. We have not been involved yet in Nigeria for the research. We have not been involved yet. But Bill Gates Foundation, they are working on it, and I think they've gone far. But this research is not yet in Nigeria.
And the report is looking promising, right?
It is looking promising.
Wow,
it's
that's
looking
nice.
promising. Yeah.
That's nice. Okay, so this is where we draw the curtain today on the conversation. I would love to thank our guests. Thank you for your insight and perspective. And to our viewers, thank you for watching the conversation. Don't forget, if a sickle cell disorder, please do well to take care of your health. Very important. And people outside that sickle cell disorder, show them love, show them care. And to our government, please try and do something about them. They are also one of your great citizens. And you never can say they might be a better citizen in the future. And today, I'm Beatrice Okimberly. See you next time.